Hello friends, welcome back. We continue with our lessons on acute prescribing and how we differentiate between different remedies, even though the clinical name or the diagnosis is just one single word or phrase. In this lesson, we shall be looking at cold and flu, a very seasonal, annually occurring, very common ailment, but something that has defied medical science till date. But that doesn't mean homeopathy has laid that to rest. Homeopathy, in fact, is very effective, and a lot of people all around the world will vouch for its efficacy, provided, of course, that the correct medicine has been chosen. One of the guiding principles of homeopathy is choosing a single remedy. And let us see how we can tackle a cold and a flu. Before we begin some serious study, here is a light-hearted poem which I have taken from the Lancet, January 4, 2003 issue. And this doctor laments that I love the doctors, they are dears, but must they spend such years and years investigating such a lot of illness which no one's got, when everybody young and old is frantic with the common cold? And I will eat my only hat if they knew anything of that. So there we are. We spend years and years investigating such a lot of illnesses that no one's got. Well, this was a bit funny and not so funny as well. So let's carry on with our lesson on homeopathic prescribing for cold and flu. If we look at the website of WebMD, the guidance given over here runs something like this. And what it says is that use over-the-counter medication to relieve the symptoms. Nobody's talking about getting rid of the disease. And later on, you can see a doctor who may prescribe an antiviral medication. And it gives the names of two such medications. I'm not here to criticize or to discuss this line of action. But very frankly, most people end up with medications which have been derived from a medical algorithm which goes something like this. You deal with congestion, rhinorrhea, aches, fever, sore throat, cough, and then what are the things to be considered? And usually a person ends up with 4 to 5 or maybe more medications. And then the cold or the flu runs its course, and then everything is forgotten until the next season or next occurrence. How does homeopathy differ? Let's take a look at a decision tree to arrive at different remedies for a simple diagnostic label of a cold or a flu. We are going to move away from the previous model or the allopathic model, which believes in or which is forced to give polypharmacy to the patient. If it is a cold, question is there a fever? If there is no fever, are the eyes or nose streaming? If that is the case, we shall see what to do in the next slide. Going back to fever, if there is a fever, are there any other symptoms? If the symptoms are there, are they violent pains? If there are no pains, we'll go to the next slide. But if the pains are there, then the best suited remedy is Eupatorium perfoliatum. This is an old herbal remedy, and in fact, the practitioners of herbology call it bone breaker. The pains can be so bad, and that is a guiding symptom for Eupatorium perfoliatum. Going back to other symptoms, if there are no other symptoms, as a matter of fact, there are no definitive complaints, just not feeling well, no fever, I can feel or anticipate a cold is going to come. In that case, Ferrum phos is very good at these early stages. Similarly for flu, is there a fever? If it is there and there are no other symptoms, just prodromal signs of being unwell, then once again, Ferrum phos is your best guide. If there is no fever, but the person is very weak and drowsy, We shall see that thing in the slide that will follow after the next. Continuing further from where we left off in the previous slide, we were left off with the symptom of streaming from eyes or nose or both. So is there any streaming? If it is no, are there any signs of an early sore throat? If not, then aconite could be your remedy. Aconite is characterized by sudden onset of symptoms, and the symptoms are quite severe. In the previous slide, we talked about ferrum phos. Ferrum phos is having less severity and the onset is slow. In fact, the person is just not feeling well. It's kind of a prodromal syndrome. Whereas in aconite, it's a very rapid action. The symptoms come on very fast. If there is a sore throat, then mercurius. Continuing further, with streaming of eyes, is there a runny nose? If it is there, are the eyes also watering? Then is the water discharged from the eyes, the tears, are they burning? Then euphrasia is your remedy. Euphrasia is also known to the herbologists as eye bright. But mind you, we are not working with principles of herbology. We are applying homeopathic principles for choosing our remedies. If the discharge from the eyes, the lacrimation, the tears are bland, then it points to allium cepa. Allium cepa is prepared from onion. And all of us are familiar that when we are chopping onions, we get a runny nose and we also get watering eyes. Also, if you have a runny nose and there is much sneezing, in fact, continuous sneezing, paroxysmal sneezing, something that can be very tiring to that person. If it is not there, then arsenicum iodatum. But if it is there, then the most suited remedy is natrum muriaticum. This remedy is prepared from sodium chloride. That's the common salt. How is that so effective in a situation where a person is sneezing so desperately? That is the magic of potentization and dilution. That is what is the magic of homeopathy. Let us continue further. We left off with violent pains and we said if there are violent pains, then eupatorium perfoliatum or bone breaker would be the remedy. What if the person does not have violent pains? Was it a sudden high fever that came on? Then belladonna could also be a remedy. I would like to add that it could be aconite as well. Belladonna is characterized with a red face. There is redness on the parts of the body. There could be redness in the throat, inside. There could be redness inside the nose. There could be a redness on the cheeks. Belladonna and aconite are both very fast-acting remedies and the onset of symptoms is very fast. But the characterizing feature of belladonna is heat, very hot to the touch, and redness. If the sudden fever was not very high or it was not very sudden, but there was a slow onset, but something that was more than ferrum phos, which we saw in the slide before the previous one, then gelsemium is your friend. Gelsemium also has another characteristic of heavy eyelids. Also, if the person is having fear and is weak and drowsy, once again it's gelsemium. So a gelsemium patient is very weak, drowsy, slow. Eyes are closing because they complain that the eyelids feel very heavy. If the patient is not weak and drowsy with fever, does he have sweating, aches and pains? Is the person feeling cold? Then nux vomica is the remedy that could work. If the person is sweating, has aches and pains and is hot, is he better or worse with movement? If he is worse with movement, the slightest movement, then it is bryonia. Bryonia is also dryonia. That means all the discharges will be dry. There'll be dryness of the mucous membrane. There'll be dryness of the serous membranes in case of joint pains. This is a very big remedy. It applies to many situations. But right now we are just discussing cold and flu. In fact, bryonia, as you'll discover later, is going to be very useful even in the epidemic of COVID-19. But the key feature over here is that aches and pains are worse when the person moves. But there are some people who feel better by moving. Rusty joints, as they call them. If you move them a little, they feel better. In such cases, Rus tox or Rus toxicodendron, that is going to be your friend in this case. Very often, people tend to use inhalations of some camphorous substances such as Vicks inhalers, or they may use rubs like Vicks Vapor Rub in case people feel comfortable using them. It's actually just a psychological thing, but they should be avoided within 30 minutes of taking a remedy. There's another video which you shall see later on in the therapeutic section where it is explained that these inhalators are actually only giving you a feeling of decongestion. They do not actually decongest, but more of that later. Let us now see the current crisis of COVID-19. If you go to the World Health Organization website, they will be listing these symptoms in 3 categories: most common, less common, and serious. You can read through this, or you can even refer to the website to see if there is anything new. But I am sure after seeing this particular lesson, you will be able to work out a case by assembling the right kind of symptoms for the individual. Mind you, homeopathy will never find a single remedy. There'll be a cluster of remedies and they'll have to be individualized. So it's not simply walking over the counter and picking up one COVID-19 remedy. Being individualized, it is going to be very, very effective. Another thing which is very remarkable and shocking as a matter of fact is that all the discussion that is going on about COVID-19, people are talking about physical symptoms. I'm sure you'll agree that the most individualizing symptom comes from the mind. 2 patients with exactly same symptoms, and we shall see examples of that during this course, will be reacting differently. One person could be having the terror, the fear of death. Another person could be in a state of frustration. He could be a different personality. There are many, many responses of the mind, and they are very important because your mind symptom at this stage, after taking all the symptoms that the person is exhibiting, mind symptoms are often the cutting edge which will be able to lead you to the correct remedy. Sadly, nobody is talking about that. I did a very big search if any website was providing a cluster of mind symptoms exhibited by COVID-19 patients, but there is none to be found for the simple reason that homeopaths are not dealing with this epidemic. They are not allowed. That's a very sad commentary on the state of affairs. Each one of the symptoms that we spoke in the previous slide will be having a cluster of remedies in homeopathy. We assemble all these symptoms together, prioritize them, which we shall learn later, and then we will see, like in a Venn diagram, they intersect. There will be some common, some overlapping remedies for each one of these symptoms. And you'll find that there'll be one point where all of them intersect and meet together, or maybe they form a small little triangle with just few remedies, 3, 4, or maximum 5, sometimes just 1 at times. Then you will read up the provings of these remedies. What did healthy people exhibit when they took these remedies? And then you will be able to select the one. The one simple single remedy which is going to help your patient no matter what. That brings us to the end of this presentation. Friends, thank you very much. This was just a short lesson demonstrating how we differentiate between remedies in case of cold and flu.